So good evening to everyone. Ashika, kindly take the control. Recording has been started. Yeah.
Yes, ma'am. So good evening to everyone. Welcome you all to HomeoVision webinar series organized by All India Homeopathic Student and Youth Association. And today's topic for this live webinar is importance of LM potency. And we have with us our guest speaker, Dr. Santosh Chincholkar sir. So he has done his BHMS from Amravati University. He has done his MD in homeopathy in 2009 from MHS Nasik. He is PhD awarded since 2023 from Tatia University, Rajasthan. He has worked as a principal Sharda Homeopathic Medical College, Washim, Maharashtra since 2 years. Founder President of PHCM Society Amravati, Founder Director of Simpathy Institute of Homeopathic Pharmacy, Maharashtra branch, Life Member of St. John Ambulance Amravati branch, Life Member of Maharashtra Homeopathic Doctor Association Amravati, ex-Vice President of Maharashtra HMAI branch, ex-Secretary of Amravati HMAI branch. He has working experience as a principal, as a professor in the Department of Homeopathic Pharmacy for 21 years, worked as an examiner, worked as a chairman Internal Vigilance Squad in MUHS Nasik. He has worked as inspection committee member on LIC inspection in MUHS Nasik, worked as sports in charge, cultural in charge, NSS officer in Amravati under MUHS Nasik University, worked as examiner in Bharati Vidyapit Pune, worked as vice president of HMAI Maharashtra branch for 2 years, and he has also publications of research paper in National Journal of Homeopathy, and he also does many social activities, and he is a management. He has also done management of administration, PHC Society Amravati for 7 years, and principal at Savita Om Raval Homeopathic Medical College, Gujarat for 2 years, and he is principal of Sharda Homeopathic Medical College, Maharashtra since 2 years. So, welcome to the session, and sir, take to you.
Yes, ma'am.
Yes, ma'am. Yes, sir. Start.
Good evening, one and all. Is my audible?
Yes, sir. You're audible, sir.
First of all, I'd like to pay my homage to Dr. Samuel Christian Frederick Hanneman. Today, it is a great pleasure for me that All India Association has given me the chance to deliver my knowledge about the LM potency. I completed my PhD session in 23. It is a great opportunity to me to work with the LM potency, because the LM potency is the one of the advanced sword in the world of homeopathy. Dear friend, I know in the first year when we study about the homeopathic pharmacy, in the homeopathic pharmacy, it is just one little chapter or the part of the scale where the faculty deliver and explain about the LM potency. But the LM potency, it is one of the long journey which is very helpful in whole life of homeopathic world. So today, first, I will explain one by one and what is the importance of the LM potency or the 50 millisimal potency in our homeopathic world, that I will explain you one by one. Now, as you know that when we are studying about the scale, as you know, various scale which was introduced by the Dr. Samuel Hahnemann in the 6th edition of Organon of Medicine. It is a long journey of the 75 year after the death of Dr. Samuel Hahnemann, how this 6th edition of Organon of Medicine was published by Dr. According to that, this scale is also the last moment of Dr. Samuel Hahnemann, who has introduced itself, and but before it published in all over the world, it's vanished for 75 years. And after the 75 years, when the original manuscript of the Dr. Samuel Hahnemann, which was published by the Dr. William Borick in English edition. So in particular aphorism, from aphorism number 270 and 271, Dr. Hahnemann has introduced itself about the 50 millisimal scale, that is the LM potency. In footnote 150 to 157, it is called as a perfect method. But as per the section 161, it is also called the renewed dynamization. Why it is called renewed dynamization? Because the previously in the decimal scale and the centesimal scale, when the dynamization power, it changed to 10 or to 100, but here it will be the 500 times, 50,000 times it will be turned into the its advanced potency. So therefore it is called renewed dynamization. In the footnote aphorism number section 132, it is called as new altered but the perfect method. Now when Dr. Pierre Smith, who was the one of the allopath who has proposed, and ultimately it gives the new method introduced by Royal School of London. At that time, he has mentioned that when there is a changes occur by 50,000 times, so it is called the 50 millisimal potency. And this 50 millisimal potency, which was introduced, the name is given Dr. Pierre Smith. Now, why the LM potency has its own importance? What is the concept? Just we will go one by one, and then you can ask your queries. Then, am I audible clearly, ma'am?
Yes, sir. Hello,
Is
sir.
I
You're
audible
audible.
clearly?
Yes, sir.
Number one, that is the rapid gentle cure is not possible due to the slow action of the centesimal potency. Now, as you know that when we are in the previous day of the homeopathy, when there is a asking about the what is the action of the homeopathy? Action of the homeopathy, there is a one quotes was given by the people. It works slowly and in long term. So rapid gentle cure is not possible due to the slow action of the centesimal potency. This is mentioned by the all over the world. Homeopathy पहले स्लो काम करती है, धीरे धीरे रिजल्ट मिलता है. The undesirable medicine aggravation is even in the well selected remedy. Now, as you know, there are the number of people who are giving the homeopathic medicine in the previous phase of practitioner. They are giving uncertainty of the potency. They don't have a proper knowledge about the potency, and because of that, judgment between the vital capacity of the body, that is the susceptibility of the body, and the potency selection is mismatch, and due to that there is a undesirable medicinal aggravation is there, and due to this is also the one of the obstacle in the flourishing of the homeopathy at ancient time. After the administration of the single dose, wait and watch for the long period time consuming action. Now, as you know, everyone is saying homeopathy late काम करती है, but this is not the fact. The fact is that when you use that sword means whether it is 30 potency, whether it is centesimals 200 potency, whether it is 15 millisol potency, but the right time, right click is everyone is close. There is no period of the time is required to take the action out of the result of the homeopathic medicine. This thing is fit in your mind because this is very important for the homeopathic practitioner. It takes the prolonged action of the drug, trouble the patient. It's long time to cure. Again and again, the same thing is going on at that time from the previous time, the centesimal scale, the decimal scale. But this LM potency will clear all the concept of the this particular action of the medicine in proper manner in the quick result at the particular long term or chronic diseases. Secondly, the frequent repetition is not possible if done dangerous. Yes, in the centesimal scale, in the decimal scale, when we repeat, the materialist quantity of that particular drug dose is more, and therefore the action of that particular drug is not controlled, and due to that, it remain to should give the medicine one day, weekly, monthly, 6 monthly, or maybe the up to single dose should be given. So all this concept is clear one by one in by the LM potency. Now, what is LM potency? What is 50 millisimal potency? The 50 millisimal potency is the highest ideal cure, is the rapid, gentle, and permanent restoration of health in the shortest and most reliable and harmless way on easily comprehensible principle. This definition, this word by one, it is the highest ideal cure. As you know that the people are suffering from the 20-year, but when they are started taking the homeopathic medicine in the 50 millisimal scale, they don't have any type of aggravation, and they rapid, gentle, permanently they cure from that particular 20-year of the and many more year of that particular in the shortest and most reliable and harmless way on easily comprehensible principle. What is this? This is the vitality of the homeopathic potency which give you the line of action in the LM potency. Therefore, I will give the one by one reason why it is happened. Now, many times there are the all over the world. Again, I am saying you all over the world there are the very modern medicine people, Ayurveda, other the system. They are saying that our pathy is the alternative pathy, but this is not the alternative pathy. This is the pathy of vital pathy, where it need to give the result to all over the world. But the peoples who are stronger than us, then they are criticize our system. So this designation of the LM potency This scale is designated from the different way in the different countries. In India, it gives the 0 by 1, 0 by 2, 0 by 3, 0 by 4. Like this, it will give by 0. This is the poppy size. This is denoted by the that poppy size globule which is used for the each dynamization, and indicated the potency which was given by oblique 1, 2, 3, 4. In the Western world, the countries, it will give the 1 by 0, 2 by 0, 3 by 0, 4 by 0, using the Roman letter also LM oblique 1, LM oblique 2. This is also the method of the designation of the L means 50, as you know. M means millisimal. So 50 millisimal is the name which is denoted because of the every time this potency which was changed their capacity 1 by 50,000 times. 1 by 50,000 times. How it will, I will explain you. The O represent the poppy size globule, as you know in the each dynamization. Now, when we are preparing the potencies, I will, in short, I will go through the fast, that is for how it is prepared with the potency. As per the 6th edition of organonormodicine, in the mode of preparation, in the mode of preparation, that in the section 270 and 271 in footnote 150 and 157, it is mentioned that during the preparation of how the 50 millisimal potency is prepared, the 50 millisimal potency is prepared by taking 1 grain plus 100 grain of sugar of milk and triturate it for the 1 hour. You will get the potency that is 1 by 100. According to the up to, it should be prepared by 3C potency by taking 1 part of the previous potency and to it add 100 grain of sugar of milk, triturate it for 1 hour. According to the 8, it should be given obtained, that is 2C potency 1 by 10 to the power 4. Like this, it should be obtained 1 by 10 to the power 6. Here, every grain is this 1 grain is equal to 65 milligram. And according to that, when the 1 million part of the 1 grain in the powder is formed, at that time it should be turned 1 by 1. So here we can understood the how it is prepared. Now, what is the part obtained? 1 by 5, 10 to the power 8. Before that, the 50 millisimal potency is prepared by taking 1C, 2C and 3C. After 3C, how it is prepared, the another potency will go through. Now first you understand this conversion of the 3C potency into the liquid form. Conversion of the 3C potency into the liquid form. For that, what we have to do? We have to take the liquid form by taking 1 part of the 3C potency, and then before that we have to prepare this mother potency. So take the 1 grain of the 3C potency, dissolve in 500 drop of the mixture of dispensing alcohol and purified water. It is ratio is 1:100. It means in that 100 part of the alcohol is taken and 400 part of the purified water is taken. 1:4 ratio. Its total part is 400 plus 100, 500. So the mixture of the 500 with 1 grain of sugar of milk, which is obtained by the 3C potency, and then you have to triturate and convert it into the liquid form. Now, previously what we are obtaining? 1 by 5, no, not 1 by 5, 1 by 10 to the power 6. Now here what is the obtained? 1 by 5 10 to the power 2. So here the trituration is converted first. It is into the mother potency. What is the strength of that potency? 1 by 5 10 to the power 8. This is our mother potency, which is the liquid form obtained from the 3C triturated form. Now, after that, the preparation of the first potency from 0 by 1 potency from mother potency. The 1 drop of the mother potency, to it add 100 drop of pure alcohol. To it give 100 downward succussion stroke. And this potency, which was the first degree of the dynamization, that is called 0 by 1 potency or 0 by LM1 potency. But you should keep in the mind, this potency start from the globule and end into the globule. Until that, this potency is not completed. Many times, many practitioner also making the mistakes that it should be when it is prepared in the liquid form, but it is not completed their part in the liquid form till it converted into the globule. Therefore, it is called as the medicament globule. So here the 0 by 1 liquid form potency is prepared, but not completed form because of the LM potency start from the globules and complete end into the globules. It is globulo-globular form method. Now the conversion of the 0 by 1 potency in the globule form. Take a poppy size globule of 500 globule, which is having a weighing 1 grain, are moistened with the 1 drop of the 0 by 1 potency and dried quickly on the piece of blotting paper. Here complete 0 by 1 potency is prepared. Now you can understand the part. What is that part? When this 1 drop of the 0 by 1 potency is moistened the 500 globules, it should be divided into 500 times. When our system is, that is when we are making the dilution, so it is diluted 500 times. Therefore, the every time the potency is upgrade 1 by 5 10 to the power 4. How much? 1 by 5 10 to the power 4. And this 1 by 5 10 to the power 4 means 50,000. So this is the magic of 50 millisieverts potency preparation. So you should keep in the mind, it start from globule and it end the complete potency into the globule. So it start. So when now here the 0 by 1 potency is prepared. Now next potency is 0 by 2. How it is the magic that to prepare the 0 by 2 potency. So what we have to take? Take the 1 globule from the 0 by 1 potency. What is that? Take the 1 globule from the 0 by 1 potency over the 1 drop of the purified water. And then add 100 drop of alcohol. Give 100 downward succussion. In the centesimal scale, in the decimal scale, we are giving the only 10 downward stroke, but here we are giving the 100 downward succussion stroke, which can enhance the property by the 50,000 times every times. So, and 0 by 1 globules, drop 1 pour the 1 drop of the purified water, give 100 downward stroke. That potency enhance the 50,000 times and you will get the 0 by 2 potency in liquid form. But still it remains incomplete. So every time the potency enhance 1 by 50,000 times and the material part is decreased by 1 by 50,000 times. So this higher degree of the dynamization here, the drug strength occur every time 1 by 5 10 to the power Oh, so this is the one of the drug strength of 50 millisiemel potency. Now, when we are preparing the preparation, at that time you must also compare. Now, then many of the people, they don't know how much potency it is available in the 50 millisiemel scale. Now, as you know that Dr. Kent, Dr. Boric, and there are the many other who are making more and more potency available prepared in the 50 millisimal also and in the centesimal also. So this potency is having a much more power, but you must know the method of the application, because the method of the application is the true which can give you the correct result above the 50 millisimal potency. So as necessary, the LM potency is prepared in the same manner by the continuing the from 0 by 1 to 0 by 30, 0 by 60, 0 by 80. It is, but now up till nowadays, it is available in the market up to 0 by 30. So that is the fact. Every time the drug strength is increased 1 by 5 10 to the power 4. So it is mentioned in our chart 0 by 1 potency drug strength 1 by 5 10 to the power 10. Then 0 by 6 potency 1 by 5 is to 6 10 to the power 30. So like this potency is increasing and you will get the more and more powerful advanced remedy in the world. Now, when you are prepared this particular potency, the technique nowadays, why the many of the physicians are avoid to give this potency, because they don't have a proper knowledge about this potency, and this potency is also the time consuming for the preparation, not for the result. This is keep in the mind. Why? Because when we are preparing nowadays, the peoples are coming, they are giving the bottles and they go away and taking their medicine. But if we can give the proper manner in proper method, then there is no difficulty to dispense this type of potency in the your practice. First of all, you have to prepare the solution, that is for the medicinal solution. How it is prepared, I will in short I will give you the description. Prepared, take the bottle of 30 ml, 60 ml, 120 ml, fill this 3/4 of the bottle with the purified water, distill water, then crush only one medicated globule to the desired potency. To it add 15 to 20 drop of the plain alcohol. It may be the dispensing alcohol or it may be the strong alcohol, no problem. Then add the 1 to 2 drop of the sugar of milk for the taste, or 15 to 20 drop of the plain globule if it is not sugar of milk is available nowadays. Then close the bottle tightly, and now keep in the mind, you can mark as per the requirement. Mark means dose. 16 dose, 8 dose, 4 dose. Now 16 dose means if you have taken the 120 ml, then according to that, the dose should be once in a day, twice in a day, thrice in a day. As per the requirement, you can advise the patient to take the dose, because the intensity of the disease and the susceptibility of the medicine should be matched with the intensity and the susceptibility of the disease condition. That will give you the result of the 50 millisimal potency. The dose now, there's next is now this is the preparation of the medicinal solution. One more thing is very important in this particular preparation of the medicinal solution. Now, as you know, the susceptibility, there are the many of the people is having a low susceptibility, many of the people is having a medium susceptibility, another is having a high susceptibility. So what is the role of the medicine in the action of the medicine in the susceptibility? The person, if is having a low susceptibility, required more more least excited patient, more it require the more succussion. If the person is hypersensitive, the patient require the less succussion. So during the administration of this medicine or the 50 millisimal potency in to the patient, at that time the intensity of the disease and intensity of the medicine should be checked. According to that, you can find out the susceptibility, and the susceptibility of the disease will give you the method whether you have to give the 8 succussion, 10 succussion, or 12 succussion. That is your skillful observation must be required, which is mentioned by the Dr. Samuel Hahnemann in the sensitivity of the patient in aphorism number 248. It is attenuate potency. After the succussion, take 1 dose of the medicinal solution. How it is taken, the patient, how the drug should be taken for the administration of the dose. After the succussion, take 1 dose of the medicinal solution, add into the glass, where 3/4 of the glass is with the pure water or distilled water, then stir it, and then 1 to 2 should be taken by the remaining patient, and remaining will be thrown away. Now this thing, the number of homeopath also, number of peoples are also, laymen also, they are criticized. What we are doing? We are taking 1 or 2 teaspoonful of the drug and another will be thrown out. Listen here. The part of the sensitivity is very important in during the cure. Now, as you know that in the previous part of the homeopathy, the number of people are saying the homeopathy से पहले बढ़ता है बाद में कम होता है. This is the manner the people are saying. Why? But the sensitivity is here. Within the 2 single dose, the 2 teaspoonful of water, this patient will be calm and quiet, and the disease will be take the in toward the recovery. The each dose applied in the same manner. If any aggravation by the taking the dose, then dilute it again into the second or third higher glass full of water from 1 to second to, and then dilute form 1, again take the 1 or 2 teaspoonful of it and taken to be the rest for the thrown away. So what is this? Many of the physicians are giving advice, but this is the true real method which was mentioned by the Dr. Samuel Hahnemann, by diluting the drug when there is a aggravation in the disease condition. As you know that the dose of Lm potency, as per the aphorism number 273 in the 6th edition of Organic Medicine, a single medicine should be given at a time. Every dose should be the minimum infinitesimal. Minimum dose. The dose which is required to stimulate the vital force, that is the minimum dose. In the footnote 282, exception to the minimum dose, it is that the treat the chronic disease which is having a miasmatic background, psoriasis, psychosis, syphilitic. We must administer the higher degree of potentized remedies, repeat several times daily. Now what happened? The people are saying miasm, but they don't know how to find out the miasmatic level and to throw out the miasm from the body. It is in the particular way, that is psoriasis, psychosis, syphilitic, every degree of level, where this level of the degree can change the condition into pathologically and also in the vital capacity. So that should be first checked, and according to that it should be administered the dose of the potency. Administer the dose in the liquid form is the quickest accomplishment of the cure. It is totally mentioned in the Dr. Samuel Hahnemann in the every aphorism of the organ of medicine, that when we are giving the liquid form dose, there are, suppose for example, I have taken the number of example in the fever case. My PhD part is also that how this particular, now what happened there, the number of pediatric patient, they are suffering from fever and they come to your clinic. When they come to your clinic, they expect from us the fever will be come down. And once we have given the medicine, if the fever will not come down, they go to the pediatrician. What is our use? But from this point, as check or my PhD topic is taken, and according to that, I have proved from the hundred of cases that when the patient come to you, you can give the dose in the repetition. If it is the high potency or high fever is there 103, 104, within the 3 hours, this particular dose in the liquid form it goes, you will get the quick action and the patient will be settled on 100. Not it directly come to the 0. It will become on the 101 from 104. And the second day it is automatically regain their condition in the recovery and the patient will be free from the without any side effect. This is the magic of LM potency. The LM potency, now this is the one part of the LM potency. There is no need when we go through the detail, there will be time botheration also. So again, I will explain you the one available scale in the LM potency. What happened? There are the many of the pioneer in our India also. They have worked a lot of things in the LM potency because after Dr. Samuel Hahnemann has given the light of the potency in our homeopathic world. But after that, there are the many some pioneer which is very work hard to understand this system and to pose this system to all over the world. So Dr. Henneman has recommended the 0 by 1 to 0 by 30, but all the majority of the patient obtain the ideal cure up to 0 by 20 potency. Yes, this is very true. Some of the pioneer like Dr. R.P. Patel, Kerala, has a lot of work. He has suffering from wounds themselves from the cancer, but he has taken the lot of work in the Kerala and huge. I salute that person. Dr. B. Mandal is used this LM potency beyond 0 by 30, 0 by 50, 0 by 60 in incurable cases. The patient, incurable cases. What I am saying, incurable cases to the other system of world, not to the homeopathy. Keep in the mind. That's why we are using here the incurable, because they say that this is the patient is not, there is no need to cure. So this type of patient is cured in the LM potency. In the today modern homeopathic world, this is the real broad spectrum 5G network of homeopathic medicine. If you use this, you will get the faster result in the homeopathic system. From what potency to start? Now, this is about the LM potency importance, but there are the many questions asked by the many of the my students and my colleagues also. So, from what potency we can start the 50 millisimal? But I think when we are becoming a homeopath, the homeopath must be keep the patience, skillful observer. They have their own quality, then they will cure the chronic and difficult diseases in all over the world. As per the universal homeopathic guideline treatment, start with the lowest potency in 0 by 1 to 0 by 6, but the practical experience is allowed to skillful physician assess the susceptibility of the patient and how he applied the knowledge of the drug in every case to case and vary the selection of potency. So this is their own part of the practitioner. In acute case where the high susceptibility is high potency, go with the 0 by 10, 0 by 50, 0 by 20 sufficient. In some cases, the vitality is too low, the loss of vital fluid, severe bleeding. Start with the low potency in better result. For that time, we have to give the more succussion after, that is 8, 12, 8, 10 or 12. 12 should be given. That is the important about the potency. In many cases, to filter the susceptibility of the patient, jumping method is applied. This is 0 by 1, 0 by 6, 0 by... That is depend upon the experience of that particular physician. Whatever the observation and the exact susceptibility of the patient must be maintained by the homeopathic physician. He is the god to that particular disease person. So he can judge what the patient is applied, what the patient is elaborate the thing in front of him. And according to that, the susceptibility will be calmed down, and then the potency will be applicable in that particular method. Now, again, the route of administration of the medicine. It is also called as the pharmaconomy. It is aphorism number 284 and 285. There are the four methods of the applicable: by oral, by ingestion through the mouth, by olfaction method, inhalation through nose, by rubbing, massage through the skin, and by mother milk by breastfeeding for the newborn. Now, one important more thing, which is the fastest affection will be obtained from the route of administration. That is the by olfaction method. Because once many of the patient, they are not able to take the medicine through mouth for suffering from cancer and all their, so you can take one medicine, particular course of medicine, put that medicine in one drop and into that empty file, and if you smell to the nose, the medicine will be work and you will get the better result than the oral ingestion. This is the fact. Number of times I try this thing with the patient who is suffering from brain hemorrhage and all this. The patient will give the better result than the other potencies. How long the first prescription will be continued? The first prescription should be continued till the improvement experience and go through the 0 by 1, 0 by 2, 0 by 3, from low to high with 8, 10, 12 succussion as per the susceptibility of the patient. The proper time of second prescription. When the new symptom appear, then the selected new medicine on the totally symptom newly and start with the lowest potency and modifying the solution of every dose to the vigorously shaking of the degree. Now, what is the magic of this potency? Suppose, for example, we are also the human being. We are also the homeopath. The patient is also giving many times the wrong intention to cure quickly. At that time, what happened? We can also make the mistake while selecting the remedy. But what happened there? Here we are getting much more better chance. Suppose when we are giving the medicine wrongly selected, but if we are getting the newly totality of the symptom of the drug, then we can make it correct within the 2 days, 3 days, 4 days. That is, but the medicine, the action of the medicine is not remain there. But what happened in the centesimal and centesimal scale? When once we given the one dose, it should be remain for up to the action of the medicine. It can remain for 10 days, 15 days, or many times. Now, repetition of the doses. It is also called pharmacoplexy. This is the repetition of the Lm potency mainly depend upon the nature of the disease. It is chronic disease like asthma, hypertension, cancer, etc., etc. Once a day, every week alternate day. Thus, long duration of action of the medicine repeated daily for a month with ever increased succussion. So this is the magic of the 50 millisimal. Those medicine which are repeated after 15 days, 20 days, 60 days. For example, sulfur. Sulfur is having 60 days of action. So we cannot repeat for the 60 days. Many of the things many of the peoples are repeated 15 days, 8 days. But here we can 0/1 potency of the particular selected similimum remedy should be daily. You can give it. It is like a work like a machine gun and not like a once we give and remain steady for the 60 days. Now acute disease like diarrhea, dysentery, malaria. Now what happened here? The low susceptibility is low. The intensity of the disease is high. We cannot get the result many times. But once in the acute condition, if we have given the by the 12th succussion in proper manner and in the proper dose by one hourly dose, two hourly dose, within the 2 days or within the 6 hours, the patient will be in control, no problem. In the urgent cases like tetanus, cholera, high-grade fever, yes, every hour, half an hour, 15 minutes, 20 minutes, 10 minutes, less than that. If the selection is correct, after the third or fourth dose, whether it is given after 15 minutes, whether it is given after 20 minutes, many times in my own clinic, I have tell the patient to sit in the clinic. After that, half an hour, we have given the dose. The patient come to us for the 102 fever, and after that, they will settle on 99. We send them at home. So this is the magic. You can try it. There is nobody is trying. They are only criticizing the homeopathy in the homeopathic world, and that's why the other people, the other system of the treatment is giving us the. Now many of the people are not thinking about this particular this LM potency because they are somewhat mismanaged. They are not ready to give this thing that yes, it is only water. But listen, my dear doctor, this is the 21st century. This is the powerful weapon which can be effectively used by the homeopath against any type of disease to become the fastest and advanced modern homeopathy. Because the weapon which is used, which can it gives the courage, wisdom, perfection, and unbounded scope to serve the mankind as well as to establish the supremacy of the homeopathy over the other system of the medicine. Once you start with the 50 millisimal potency, you will get the magic effect which cannot produced or given by the any other system of the treatment by yearly, and you can give this result within the 8 days, within the 10 days. The patient will definitely faith on the homeopathy in lifelong. So the LM potency has a broad revolution in the field of medicine. If you realize yourself first, and then you can realize the system in homeopathy. Now, special characteristic of LM potency. Once, as you know that in the decimal scale, we can reduce the drug in 10 times. In the centesimal scale, you can reduce the drug 100 times. In the 50 millisimal, the drug minimum is going to the 50,000 times. So therefore, the minimum homeopathic aggravation is produced. There is no any other aggravation is obtained. Due to the high intensity of the vitality, the quick cure of action is taken place in the deeper and deeper part of the body. It should be penetrate and it will recover the chronic diseases from the yearly. They are from 20 year, 40 year, but the right thing is there. There is no any other another mode. If we require the repetition, it is permissible because the material quantity is less, so there is no aggravation. Judge the correct medicine in the shortest period. You will get the result in the quick form. Whether it is not getting the result, you can change the medicine. That is your observation. So this is the best characteristic, special characteristic, efficiency to turn the incurable to the curable disease. That is depend upon the physician and that it will make the explanation. Use both the purpose, curative and palliative simultaneously. Now what happened? Nowadays, due to the lot of things in the all over the world, suppose for example, there is one patient come to me. He has taken the medicine that is radiation 24 to 25 radiations are there. They have taken, they are suffering from the oral cancer. Now tell me, what can I do for them? Someone tell them to go to the doctor, they will cure your thing. Before that, I have cured 2, 3 patients. So that's why they come to me. But still, I explain them the condition of present condition of the pathological level is third degree, and so there is no way we have to only palliative the system, and I reduce the pain up to the 80%, not more than that. So this is also the because of LM potency it is possible. Otherwise, the some other potency is not work at that place. So this is the real was thing of the or characteristic of the LM potency. The action is quick and rapid in the mental psycho cases. Yes, cure with the smooth with laced without aggravation. I cannot explain you how the psychological effect of the patient will obtain. I have a one lady who has started their psychological treatment from last 10 years when I started their LM potency calcarea carb 0/1. Up to now, he is on the 0/3. In the previous part, I have given twice, thrice a day. But now he has taken one bottle of the 60 ml, and weekly they are coming to me and they are taking 0/3 potency only one dose a daily without any allopathic medicine tablet. What is this? What we are giving them? We are giving just only the small minimum dose. And the effective in the treatment are arose and suppress the state of disease. Yes, there are the many of the patient who come to the homeopathy that is from suppression. They are taking the lot of things are before reach to us. When they are come to us, at that time we have to give the higher power. But higher power means advanced power. Advanced power means LM potency. But you must know the method, how to make it prepared and mentally as well as find out the proper symptom of the patient. LM potency gives the full freedom to both physician and the patient from the all obstacle like homeopathic aggravation, wait and watch for the long period. In case wrongly selected medicine, it can be also the physician must be correct without quick and antidote. So this particular potency is very economical to the physician also. So dear friend, up till now, I have explained you about the LM potency, 50 millismol potency. There is a one good experience of my life of a case of a girl who is a 3-year-old suffering from the Bell's palsy. On the 29th April 2021, she was diagnosed as a Bell's palsy by the allopathic pediatrician, and then he came to me because his father is faith on fully on me. So in the morning, she had complained a dropping of one eyelid, lip was tilted to one side, and watering from the eyes. So the father went to pediatrician with and 7:30 the physician told that first do the MRI brain, then only I will start the proper treatment to the physician. Physician not given any medicine, but her grandfather and father is a regular patient, so he called me and explained condition. Then I told them to send my clinic at 9:30. So the patient enter in my clinic at night at that time 10 a.m. and given me the all history. I examined them, observed skillfully. Near about 10:30, the patient was very drowsy and he sat on lap on the mother. Patient constantly wiped the water from the eyes. Weeping was also there. Patient told the mother, I feel nausea, want to go outside the cabin. बाहर लेके चलो, बाहर लेके चलो. मुझे vomiting होगी, vomiting आएगी. Then they went to outside, but no vomiting. Again entered the same complaint. On inquiry of the mother told she feel comfortable outside the house at open space air. Today from the morning she is very disturbed and irritable. There was no fever, no cough, no coryza, nothing. After when I asked about the IPR, the mother told we have in the joint family with total 4 kids. She behaved very good with all, but want all the toys for herself. Cousin sister and brother की भी टॉयज इसे ही चाहिए रहते हैं सब उसी को चाहिए सो दिस इज द टेंडेंसी देन हर मदर टोल्ड थोड़ी देर रोती है बट समझाने पे बाद में मन मान जाती है सो ऑन दिस पीपी आई कंसिडर द आईपीआर and then start the dose of 200 potency with the frequent repetition at 10-minute interval 3 dose. What I have given? 200 potency. Directly not given. And after the 30-minute, 80% dropping of eyelids and tilted lip came to the normal. Now this is the selection of potency. Whatever I have given you the whole history, everything, IPR and selection of medicine is correct, you will get the result. It's the smartness of the homeopathy. But after that, at night, SL was given along with them. Then the second day, no change in the case. SL is given. After 3 days, a single dose of 1M potency is given. Continue for 7 days. After recovery, total 90% SL is next 7 days. But the patient is stable, not completed, restoration of health. Then the patient between went to the neurophysician. Listen here, when they are come to us, still 90% the patient is recover. But when they feel anxiety, then they go to the neurophysician, examine them from them and confirm the recovery, whether the again it visited to my clinic after 7 days in between this thing. Now is I am audible? So
Yes, sir. Audible.
audible?
Yes, sir.
Okay, okay. Here there is a screen. Then patient come to visit again to my clinic after 7 days. Now the symptom only remain after eyelid is affected and twitch suddenly blink. After that, I started my journey of 50 millisievert scale, and I prescribed 0 by 1 potency, that is LM 1 potency in the medicinal solution. Dose 1 dose daily, magic with the potency explore. You are completely within 2 days. This is the magic. This is what I am showing here, the journey. I started with the centesimal scale. But what is the need of 50 millisievert scale? If once I started previously also with the 50 millisievert scale, the patient will be cured within the 2 or 3 days. So one more important thing is the mental condition is completely restored here. This is the most important thing in the case. And the Bell's palsy weakness in the muscles on one half of the face will remain recover. The Bell's palsy may be a reaction of the viral infection, as you know. The case is solved with the mental and the behavior of the patient. When the patient comes to us, is very irritable due to the continuous watering from the eyes and weeping mode. So the rubric of irritability of the children when sick, weeping children in, and all this sick rubric is taken. I will show you the chart. Then the case move on. She is continuously told the mother bringing outside the field nausea, that is the open air, like this. The tone of the patient is very pitiful. She complained to the other, मुझे बाहर जाना है. वो IPR में लिया, IPR से. Then all this pitiful complaint in the children, all this thing is taken, and rubric remedy should be given, that is pulsatilla. This is the pulsatilla 200 3 dose after 10 minutes of interval. Within the 30 minutes, 80% is complaint recover. After that, this is the rubric, and this is the repertorial chart which I have find out during the case, and you will get the pulsatilla is having a 5 mark, and all the symptoms are totality of symptoms completed, and patient will be, this is the, when the patient come to me, this is the Bell's palsy, is the dropping of eyelid, face after 30 minutes. Then after 2 days of 50 millisievert potency. Now here, see. So this is the magic of the homeopathy, and by the LM potency, because of the LM potency, otherwise this patient move to the allopath, and the allopath always criticize us that they don't have anything, they don't have any medicine. But still, when you use this particular potency in the proper manner, then it is very helpful for our system and also for our homeopathic treatment. So I deliver the importance of LM potency as well as in the homeopathic practice as per my own knowledge. If anybody is having any type of any or any question, you just ask me. I will try to complete their answer. Hello. Hello.
Yes, sir.
Ma'am, everything is all right.
Yes, yes, yes.
I Any question, any queries?
If anyone has any question or query, please raise your hand. Mute and ask.
I try my level best to explain the 50 millisieverts potency, LM potency. From last 24 to 25 years, I started my practice, and now from 12 year I'm doing the only 50 millisievert practice, and also completed my PhD in the LM potency in the fever cases. So it is one of the best scale, but you must understand the 50 millisievert in the proper manner, because it is need the highly intellectual part to understand the efficiency of the patient and the efficiency of the medicine in plant kingdom, animal kingdom, mineral kingdom, and also nosode, sarcode, isode, and hyalosode. Because every source is having their own ability. That ability must be first understand, and then it should be implemented in the practice.
Yes, sir. The session was very insightful and it was motivating at the same time, along with the clinical tips you gave and your experience which you shared. It was all worth the session and it was amazing, sir.
Thank you, ma'am. If anything more for me, you just tell me. I'm always do and the knowledge about the homeopathy to flourish all over the world, because it is my duty also to give the knowledge to everyone. And one more thing I would like to explain you. In the Maharashtra, only myself, I have started my Sympathy Institute of Homeopathic Pharmacy. I am dealing with the, I am working as a principal in Ishwar Homeopathic Medical College, near in Newly College is there in the Maharashtra. But along with that, I am also working in the Sympathy Institute of Homeopathic Pharmacy started by myself. It is the branch of Delhi, and here we are giving the knowledge about the foundation course in homeopathy. There are the many people in the all over the world. They are only reading the books and started practice or taking the medicine their own family. But we are giving the right knowledge them to, for the 6-month course is there. Second course is certificate course in homeopathic dispensing, which was the course by certified by the government of India. This is the 1-year course for the 10th pass people. Third course we are giving, that is the DHP, Diploma in Homeopathic Pharmacy. Now, as you know that all over the India, there are number of homeopathic colleges are there, but not in the homeopathic pharmacy college. So we are giving the homeopathic pharmacy college, that is Diploma in Homeopathic Pharmacy for 2 years, and fourth course is degree, that is the Bachelor in Homeopathic Pharmacy. So we are started these courses before 7 years, and we are the 4 batches are there. We are in the journey and taking homeopathic pharmacy education for the to flourish all the homeopathic world. Many of the people have started the pharmacy also. Many of the people are getting the job on the basis of homeopathic pharmacy, diploma in homeopathic pharmacy. So if anybody interested, you just contact the Jain madam and they will give the information to you. So thank you, ma'am. If
Thank you
anything
so much,
else,
sir.
thank you.
Thank you, sir.
Thank
Thank
you,
you.
Parek ma'am, who has contact me and asked me to deliver such a nice topic, that is importance of LM Potency. Thank you.
Thank you,
Thank
sir.